Let's dive right into this explainer and decode the real cause behind your frustrating back and leg pain. If you've been dealing with low back issues, sciatica, numbness, or that scary feeling of weakness, you already know exactly how much it disrupts your daily life. It's exhausting. So our goal today is to calmly and clearly look at the facts. We're going to break down what is actually happening inside your body so you can finally understand the true root cause of your discomfort.
Picture this incredibly relatable scenario. You've got this pain running from your back all the way down into your leg. Maybe your foot is constantly tingling or your calf just feels numb. Even a simple walk to the mailbox is suddenly getting so much harder. So you finally go to the doctor and you're handed this incredibly vague diagnosis. Well, you have a pinched nerve. Now, sure, it's kind of validating to finally have a name for the pain, but honestly, it usually leaves you with way more questions than answers.
Here is the roadmap we're going to walk through together today. 1. Beyond the pinched nerve. 2. Pushing out versus closing in. 3. Reading your symptom clues. 4. Why the pattern matters. 5. Matching treatment to cause. And finally, 6. Safety and next steps. Section 1. Beyond the pinched nerve. Getting the full picture.
Okay, so being told you have a pinched nerve isn't exactly wrong, but it is super incomplete. It's a lot like someone telling you your car won't start because the engine is broken. I mean, true, but you kind of need to know why in order to actually fix it. Two completely different spinal issues can cause the exact same symptoms. The core difference really comes down to this. A herniated disc is something suddenly pushing out, while spinal stenosis is something slowly closing in. Both end with a nerve simply not having enough room, but how they got there is fundamentally different.
Section 2. Pushing out versus closing in. Let's look at the mechanics.
A herniated disc happens when the soft, jelly-like inner material of a spinal disc pushes right through a tear in its tough outer wall. Just imagine squeezing a jelly donut. When that disc material pushes out, it completely invades the space where your nerves live. It mechanically squishes a specific nerve root, for sure, but it also triggers severe chemical inflammation. This combination makes that nerve incredibly angry and highly sensitive. Now contrast that with spinal stenosis. This is a very different process, where the nerves basically just run out of room over time. The space where the nerves travel gradually narrows down due to the natural wear and tear of life. We are talking about arthritis, thickened ligaments, and bone spurs slowly building up. It's a very slow closing in that ends up crowding the nerves over months or even years, especially when you are standing upright or walking around. Section 3. Reading your symptom clues. It's time to listen to your body. You know your body better than anyone, so you can actually act as a detective here. Just look at how the loud, sudden, and sharp disc symptoms totally differ from the quiet, gradual, heavy nature of stenosis. A herniated disc usually announces itself out of nowhere. You bend over to pick something up, and boom, this sharp, electric, burning pain shoots down your leg. Sitting down or even coughing makes it so much worse. Stenosis, though, it sneaks up on you. Your legs just start feeling unusually heavy, tired, or achy, specifically when you are upstanding or trying to walk. And that leads us to a pretty fascinating real-world clue, the shopping cart sign. Have you ever found yourself in the grocery store leaning heavily over the handle of the shopping cart because it magically helps you walk farther and eases that deep ache in your legs? Well, that is a classic sign pointing directly toward spinal stenosis. The reason it works is that leaning forward slightly flexes your spine. That physical movement actually opens up the spinal canal, giving those crowded, cramped nerves just a tiny bit more breathing room. Paying attention to exactly where you hurt is another massive piece of the puzzle. A herniated disc almost always hits one specific nerve root. That means you'll usually feel that sharp, shooting pain going down just one specific leg, following a very specific, recognizable path. Spinal stenosis is a much broader narrowing. Because it often crowds several nerves all at once, you might feel that heavy, tired ache in both legs simultaneously, or you might notice the pain shifting back and forth from side to side. Section 4. Why the pattern matters. Matching imaging to pain. Gathering all these clues is absolutely vital because it's so easy to think a quick MRI will just magically give you all the answers. But we really can't just rely on what a machine prints out. A scan might show all sorts of wear and tear, but if that image doesn't perfectly align with where you actually feel your pain, it's simply not the full answer. A specialist really needs to see if your day-to-day experience, how you walk, your reflexes, where the numbness is, matches the pictures on the screen. We have to treat the person, not just the MRI.
Okay, ready for a plot twist? It is entirely possible to have both of these conditions at the exact same time. And we see this quite a bit, especially for folks in their 60s and 70s. You might have a spinal canal that has been slowly, quietly narrowing for years without really bothering you. But then a disc herniates. That sudden push of disc material into a space that was already getting tight, that is the sudden event that finally pushes everything right over the edge and triggers severe symptoms.
Section 5. Matching treatment to cause. Getting the right care. Getting this diagnosis right isn't just some academic exercise. It totally dictates your road to recovery. And the major difference here is how your body actually responds over time. Many herniated discs can genuinely improve and shrink without ever needing surgery. Your body has this amazing ability to reabsorb that extruded jelly over time, which calms the nerve right down. Spinal stenosis, on the other hand, is a permanent structural change. Things like bone spurs and thickened ligaments, they just do not shrink away on their own. But here is the good news. A diagnosis of either one doesn't automatically mean you're being wheeled into an operating room. Specialists use conservative care to successfully manage both conditions all the time. Targeted physical therapy, anti-inflammatory medications, and image-guided injections can work absolute wonders. They help calm that inflammation and get you moving again before a surgical decompression is ever even brought up. The right care team is going to exhaust every one of these options based on your unique situation.
Section 6, Safety and Next Steps. When to get urgent care. Now, while you are working with your doctor on a proper diagnosis and trying out conservative treatments, we need to talk about safety. There are a few urgent red flag signs you should absolutely never ignore. Please seek an immediate medical evaluation if you suddenly can't lift your foot. That's a condition called foot drop. Or if your legs are getting progressively, rapidly weaker. Same goes for any sudden new changes in your bowel or bladder function, or any numbness in the saddle area between your legs. These are clear signs of severe nerve compression that demand rapid attention, not just casual observation at home.
I want to leave you with a really empowering thought today. Simply knowing why you hurt is the very first step to feeling better. Please never settle for a vague answer like, it's just a pinched nerve, or, well, it's just aging, when true precision is actually possible. A proper diagnosis literally opens the door to a targeted, effective treatment plan. So keep asking questions, keep tracking your specific symptoms, and always advocate for yourself. Understanding the difference between something pushing out and something closing in might just be the exact key you need to get your active life back. So based on what we explored today, what is your body really trying to tell you? And are you ready to demand the right answer?